My name's Annabelle. Today I'll be talking about our research topic of how to prevent pressure ulcers. In our group we have Brooke, JaLayja, Chris, and Zach, who will also be speaking over what they found on their individual topics over our PICO statement, which is in immobile adult patients in acute care settings, how does nursing compliance to turning the patients every 2 hours compared to repositioning every 4 hours affect the incidence of pressure ulcers during a 2-month hospital stay? And I'll be going first over my topic that I picked. My article is Intensive Care Nurses' Knowledge of Pressure Injury Prevention. The purpose of the research question for this article is to assess the knowledge of intensive care unit ICU nurses regarding the prevention of pressure injuries. And the research question is, what is the knowledge of intensive care nurses during pressure injury prevention? The design is a descriptive cross-sectional study, and I chose this article due to it being ICU nurses conducting this study who deal with patients who are immobile for a longer length of time, so these patients that the ICU nurses see are more at risk for pressure injuries, so they'll have more insight on how to prevent them. This article was also done in South Africa. The sample descriptive was a large group of ICU nurses, 101, mostly female, 30 to 39 years of age, and the experience of each nurse ranged from 6 months to over 20 years. They used multiple measures and interventions, such as a revised pressure ulcer knowledge assessment tool, self-administered 25-item questionnaire, and assessed 6 knowledge domains, such as etiology, classification, observation, risk assessment, nutrition, prevention, specific patient groups. It's a descriptive statistics for the statistical test. Then the general strengths were 100% response rate. It's focused on high-risk populations in the ICU setting, which ICU patients. Then the weaknesses were limited generalizability. Single providence, and then low interval consistency, cross-sectional design, and then recommendations to introduce mandatory ongoing PI prevention training for ICU nurses, revised nursing curriculum to strengthen prevention and classification of knowledge, develop South Africa specific knowledge assessment tools, and consider longitudinal studies to assess knowledge retention over time. This article was done by Class and Cerbero in 2024. And that's all I have for my statement, and Brooke will be going next.
Hi, my name is Brooke Hill, and I will be talking about the article I chose that helps further represent our PICO statement. The article I chose is Pressure Ulcer Prevention in Practice. The purpose and research question of this article was to evaluate the impact of pressure ulcer prevention and educational intervention on self-reported knowledge and confidence of healthcare workers in residential and domiciliary care settings. The research question of my article was, does a targeted educational intervention increase healthcare workers' perceived and actual knowledge of pressure ulcer prevention? There were a total of 571 participants in this research study, with a mix of health and social care staff, informal and public careers, male and female, and it took place between 46 care facilities across Northeast England. Measures used during this research were educational intervention aligned with the React to Red and Skin campaigns, 4-hour training sessions on pressure ulcer recognition and prevention, pre, immediate, post, and 3-month follow-up self-reported questionnaires. There is no specific statistical test used during this research. It was all based off self-reported data comparisons across 3 time points. The results of this research were increased perceived knowledge and confidence immediately post-training, no significant correlation between perceived and actual knowledge. Knowledge retention varied at 3-month follow-up, high staff turnover, and dual site work affected follow-up and consistency. The general strengths of the study was that there was a large sample size, real-world setting across multiple facilities, clear benchmarking of knowledge, and the integration of national pressure ulcer prevention frameworks, React to Red and Skin. The general weaknesses of the study was a lack of formal assessment of actual knowledge and skills, no control group, and limitations due to COVID-19. And self-reported data may lack validity. Recommendations of this research would include formal knowledge assessment post-intervention, implement mentorship programs for sustained learning, tailor training to individual roles and learning styles, consider more robust mixed method evaluations, and to continue follow-up beyond 3 months for a long-term impact.
Hi, my name is JaLayja Cheffin, and the article that I chose to do was Impact of Care Bundles on Prevention of Hospital-Acquired Pressure Injuries. I chose this article because it's a systematic review and meta-analysis, which means it summarizes results from many studies, giving stronger, more reliable evidence than just one study. Our PICO statement states, in immobile adult patients in acute care settings, how does nursing compliance to turning the patients every 2 hours compared to repositioning every 4 hours affect the incidence of pressure ulcers during a 2-month hospital stay? This study wanted to see if using care bundles could lower the number of pressure injuries in hospital patients compared to usual care. Data was gathered from 9 studies with a total of 29,617 patients in different hospital settings. Some measures and interventions were the use of pressure injury prevention bundles. Some included turning schedules, skin checks, special mattresses, and education, compared to hospitals doing standard care. Meta-analysis statistics, including risk ratio and confidence intervals, were used to compare the results across studies. The results of this study was that care bundles helped reduce the number of pressure injuries. Patients had fewer and less severe pressure injuries, and hospital stays were shorter. Some strengths of this study was that there was a large number of patients, it was real-world hospital settings, and it looked at multiple studies for stronger evidence. Some weaknesses was that some differences between studies, not all bundles were the same, and there was limited information on long-term outcomes. Some recommendations, a recommendation would be that hospitals should consider using care bundles to help prevent pressure injuries in adult patients.
Hey, my name is Christopher Gatson, and the article that I chose to cover was Reducing Hospital-Acquired Pressure Injuries in a Cardiothoracic Intensive Care Unit. In our PICO statement, it states, in immobile adult patients in acute care settings, how does nursing compliance with turning the patients every 2 hours compared to repositioning every 4 hours affect the incidence of pressure ulcers during a 2-month hospital stay? The main purpose of this study was to lower the number of hospital-acquired pressure injuries, also known as HAPIs, in a cardiothoracic ICU. The researchers wanted to see if using a specialized risk assessment tool such as the Cuban-Jackson scale, along with targeted prevention strategies, could make a real difference. The study involved about 204 patients, half of which were observed before the intervention and half after. Both groups received standard care, which included the Braden scale and skin care bundles. However, the post-intervention group used the Cuban-Jackson scale linked to specific prevention measures, and they documented their work on paper each shift. Nurses were also surveyed before and after these changes. Statistical tests like the independent t-test and Fisher's exact test were used to analyze the results, and the findings were impressive. The prevalence of pressure injuries nearly dropped by 68%, and the incidence rate dropped by about 36%. The total number of pressure injuries decreased from 13 to just 3. And nurses' feedback showed that 83% found the new tool, which was the Cuban-Jackson scale, useful, even more so than the older Braden scale. While the study showed clear benefits, it did have its limitations. It was conducted in just one ICU. It used paper documentation and had a relatively small sample size for the injury cases, which could also affect the results. There are a few things that I would recommend the article change. These include integrating the Cuban-Jackson tool in the electronic system for easier use, expanding the study to different ICUs, and conducting larger, more randomized trials to strengthen their evidence. In short, this study demonstrates that a more tailored approach to pressure injury prevention can significantly improve patient outcomes in the critical care setting.
Hi, my name is Zach Crain, and my article was The Effect of Pressure Injury Prevention Care Bundles on Pressure Injuries in Hospital Patients. Our PICO statement was, in immobile patients in acute care settings, how does nursing compliance with turning the patient every 2 hours compared to repositioning every 4 hours affect the incidence of pressure ulcers in the hospital? I chose this article because it's an observational study using cross-section data as well as data analysis. The purpose of my study was to look at strategies to prevent pressure injuries in acute hospital settings. The sample size was really big. They used 296,014 patients and included 1,801 acute care facilities across the country. Measures and interventions. The study used different prevention strategies. These consisted of floating the heels, moisture management, elevating the head of bed, nutritional support, daily skin assessments, repositioning, minimizing linen layers, and the use of support surfaces. For statistical test, the study used many different descriptive statistics such as means, frequency distributions, as well as standard deviations. The results found that, for example, nutritional support was examined in 55 to 82% of the patients. Resulting pressure injuries were found in less than 2% of these patients. Elevating the head of bed, most patients had theirs elevated at over 30 degrees, and it actually found that too much elevation is correlated with worsening of pressure injuries. Moisture management was used in 71% of patients and 89% of patients with hospital-acquired pressure injuries. It was found to be helpful in preventing new or worsening of current injuries. Pressure redistribution surfaces were used in 74.6% of patients, and it found that earlier use for patients who are more at risk is very beneficial. For daily skin assessments, this was used in 86% of patients with no hospital-acquired pressure injuries. The study found that assessments were not necessarily beneficial in preventing them, but more so in identifying them. Routine repositioning was used in 67 to 84% of patients. 9 to 11% did not receive any repositioning. And the study found that when repositioning is not used, there is significantly increased risk for development of pressure ulcers. Heel elevation, 60% of the patients had their heels elevated, 31.9% did not have heel elevation, and 6% did not need it at all. This evidence is backed by the lack of use of the technique can lead to the development of pressure injuries in the heels of these patients. And finally, minimizing the number of linen layers used in around 76% of the patient. This is an intervention that's not frequently used, but it can be beneficial, and it was found to be underused in around 25% of the cases. The strengths for this article were the large sample size, obviously, 296,014 patients. That provides a wide range for accuracy, and the use of many different prevention strategies as well as the numbers that were provided for each. The study also used IPUP, which is widely used for research and pressure injuries. For weaknesses, I thought the study had limited ability to differentiate between strategy and outcome. It would be better if it had more detailed results for each strategy that was used. And some factors were not taken into account during the study, such as the amount of nurses or CNAs available, as well as any comorbidities the patient might have had. As far as recommendations, the study would be better if it had more detailed results for each prevention strategy, and it would be more accurate if it had the amount of staff available as well as comorbidities. But yeah.
Based on our group's findings, with further research, will be needed to truly grasp an understanding on the comparison between 2-hour repositioning and 4-hour repositioning of patients in its effectiveness in the prevention of pressure ulcers. Turning a patient every 2 hours has been seen to be better reduce the risk of pressure ulcers, but there are a lot of aspects in a hospital setting that hinder the ability to properly follow the recommendation. Staff knowledge about pressure ulcer prevention, availability of staff, condition of the patient, as well as many other influences all affect the occurrence of pressure ulcers and the ability to reduce the incidence. Based on our group's findings, we all agree that repositioning the patient every 2 hours or more frequently does benefit and reduce the risk of causing pressure ulcers, but there is a need for further research along these topics. And that's our presentation over pressure prevention.